Hello.
Yeah, hello.
How are you?
Alright.
So Deborah, you say what happened to the child?
The child was coughing. She was having fever. In the evening time, her skin can get hot. She's burning with fever. And I told her thermometer yesterday, 36.7.
Say you hold her.
Don't be scared, yeah? Not doing anything to you, yeah?
I was just listening to her lungs, and then she have this kind of real in her lungs. Okay, so the medicine she gives you, you should be able to take it and give it to her the right way she told you to give it to her. You can crack on the stomach.
Yes. Sorry, Mama.
I forgive baby. You're not that easy. So prepare the referral form for that baby now. Alright. Looking weekend.
Liberia suffered 15 years of war. We have one of the worst doctor shortages in the world. 51 doctors after the conflict to serve 4 million people. Geographically, it's a challenge. Liberia is over 2.5 million acres of rainforest. The tyranny of distance is what we talk about, that if you're too far away, you're the last to receive health services, but you're the one that often needs it the most.
I'm Serena Kuhn. I'm a community health worker in Solo Village. I'm here to make sure that my community members access health care. Hi, husband.
Yes, stomach problem.
Did you know here? You spend time with you. And you feel with Badinzo. You really Badinzo. I do active case finding. I go to my community and ask them how they are doing. So I give you the medicine.
The medicine, the one way me photo.
If something happens in my community, I will know. When somebody die in my catchment, I know. When somebody give birth in my catchment, I know.
What's the milligram you're treating her with? You say she 1 year, right?
Yes, I'm treating her with 50 milligrams.
50 milligram what?
Of the ACT.
Okay. I'm Dana Dennis from RTI, Upper Yanning District. I supervise the community health assistant.
I'm Emmanuel Semira. I work for Last Mile Health as a community health service supervisor in Bojiwon.
The training that these folks receive covers everything from tracking the next Ebola, the next disease outbreak, to treating children for malaria, diarrhea, pneumonia, and malnutrition, 4 of the most devastating diseases that contribute to child mortality.
One of my biggest challenges is that my communities are far apart and I have to walk a very long way. I have to ride a very long way before I can get to one community.
It was very difficult, especially with the rainy season in Liberia now. Walking through the very small path, you have a lot of water. Sometimes you have cassava snakes. Sometimes you are sliding, you are falling. It's very tough. But some days you have like 6 creeks to cross, and some days you won't cross at all because the water will be filled all in the forest, and you cannot attempt. You'll be taking risk. It's not very easy. It's a tough terrain actually.
What is his name? George. George, eh? George. So you asked about. So it sounds like breastfeeding practice is the main issue, right? Or what do you think? Is that it?
She was not feeding, the right amount of time. She's supposed to get the breast.
Yeah.
Even when the child refused the tete, she didn't get the right amount of food,
Yeah.
So
I'm just going to listen to him, okay?
Before the CHS program, it was blank. In fact, people didn't even know the basic knowledge on illnesses. What were causes of illnesses? People blame them on witchcraft. People were still using herbs, and children were dying from minor things that could be solved at that time.
So they are taking you today to Sestos so that they will look after this child. This child needs food. Then your child will be as big as he was before. But if this child remain here, maybe the condition will continue to go down, or maybe, who knows.
The health status of children now has improved greatly. Before, we had huge cases of malaria in the community, pneumonia and that of diarrhea. But with the treatment and with the health education, we are doing great.
So what happened to your eye? Was painful?
Yeah, a dragon passed in my eye. Yeah.
Dragon?
Yes.
And was there some white?
Yes, blood is shining on it.
All right.
Yes.
Okay. So, Papa, let me look at your eye, okay? Lens is the one that helps to make sure that the light that comes from outside goes in there. Now, his lens is not transparent. And in the medical term, we call that cataract.
Yeah.
Now in this community, people feel that we are savior now to them.
Yeah. My name is Simon.
Because they don't have to pay money to go far. Not everybody have money.
The next time I'm coming for outreach, make sure you come to Boji 1 to meet me and get the feedback.
Thank you.
All right? Good. You're welcome.
Look at the whole medical field, it's all about sacrifice. We try to awaken the conscience of the ministry that indeed there are people at this place and we've been there and we are there. Can you help us to reach to these people because they need your services? We are all Liberians. This is part of Liberia.